panel, which is Indigenous Knowing, Being, and Doing. And one of the things that really I enjoy about this particular conference is that we are agnostic in terms of making sure that this isn't just an ASU event. We have a lot of contributors, as you saw earlier, from other institutions across the country. We recognize that we're all working with Indigenous communities, not just in the United States, but the Americas in general. But we do have Myra Parker from University of Washington as part of our planning committee from Seven Directions. We have Dr. Kelliher, who again is one of our panelists today. So we have, leading this is going to be Agnes Attakai from the College of Public Health at University of Arizona. So I'm going to turn it over to her and she'll lead this next panel. We have lunch at 11:30. It might be a little bit later. It's such a packed agenda. You're going to have 15 minutes to grab your box lunch, and then we're going to jump into a lunch panel session as well. So just want to let you know what we've got on deck. So again, Agnes, thank you for joining us, and it's all yours. So there's all your speakers.
So good afternoon, everybody. Shane na kaiden en shot so ne bashin tkachi ni da shara tabadishna tisto eta nasha ICA clean to olya they based in the nasha do Tucson, Arizona, the Kachugan University of Arizona, the Banashnish. So I'm Agnes Attakai. I work for the University of Arizona College of Medicine and College of Public Health. And today we're going to be talking about being a good relative in research. And we have three outstanding Indigenous scholars who are going to talk about different perspectives of being a good relative, coming from the community perspective and the importance of language and culture, coming from talking about leadership and how we can train current and future leaders, and the importance of language in those aspects. And so for today's session, all of our presenters are virtual due to a variety of different reasons, weather, personal issues, things that have happened, things happen in our community, but through the benefit of Zoom, we have our folks here presenting. And so what we'll do is we'll just go one through each of the presentations, and we'll try to make some room at the end for some questions. So, but due to time, we may not have enough time for questions, but make sure you have some in the chat. So if our presenters are on chat too, they can answer some of those questions for those of you who are online. So the first person we have presenting is Dr. Kelliher, and she'll present on her project. And after that will be Dr. Russo Carroll, and then finalizing the last presentation will be Dr. Nelson. So Allison, do you want to go ahead and start sharing your screen and presenting? You have 10 minutes.
I'm happy to. Dahatne, nice to see everyone, and I'm so honored to join you by Zoom. My teacher, Rita Blumenstein, told me that in the future, all Indigenous peoples of the world would be connected by great-grandmother spider web. So here we are on the internet, and I'm so happy to be here with you. Let me share my screen in regards to this collaborative research network that I'm working on at the University of North Dakota. We call it ACORN, the American Indian Collaborative and Rural Research Network. And Allison Kelliher say uza tlege hutana etzlan tonitzigetsithni te hutana etzlan nalahedo hutsan sedonsaled. I am Dana, or Koyukon Athabaskan. We come from the Middle Yukon River. King Salmon people stand for resiliency. And I currently work at the University of North Dakota School of Medicine and Health Sciences, where I'm an assistant professor in community and family medicine, and also direct our practice-based research network. And I'll talk to you a little bit more about that. So my traditional healing teachers said that there would be a time in the future when the white raven would return, and that would be a time for our medicine to return. And my patients have been sending me snapshots and pictures of white ravens from Northwest Coast and Vancouver area for years. So I'm trained as a family medicine doctor, but also double boarded in integrative and holistic medicine. And I trained as a tribal doctor at South Central Foundation in Anchorage, Alaska, and I'm really honored to carry our traditions. I've worked as in the healing arts since I was 4 years of age, starting by walking on back. So I spent the past 40 years working on how to listen and help facilitate healing. I don't feel like it's me that does any of that work. It is a power that is beyond me. And I also serve on the Association of American Indian Physicians Board, and just want to mention that we have some initiatives you may want to be aware of that combine regional workforce development nationally and advocate for Indigenous perspectives in education. And those are the iHeart and iHeal initiatives. So in being a family doctor, I realized that there was a limit to how much I could do one-on-one, especially during this pandemic. And I returned to research and found a cohort of family, a Tioshbaye, we would say here in the Midwest, in Lakota. I found a family of researchers and scholars who are Indigenous here at the University of North Dakota, and we're working closely with those long-term relationships that you've heard about today, those longitudinal lifetime relationships that are already established in order to create those research networks. So we'll look at what is a PBRN, just so that you're aware that these are research networks nationally and internationally that can help to combine research, especially to strengthen our voices as Indigenous peoples. And we heard so much inspiring work from Navajo Nation and their work on troubleshooting and making genetic research more ethical, which is absolutely necessary. And these dialogues are taking place across the globe. And we have a lot to add to other communities who are struggling, or maybe some other communities who have other strengths, such as in Arichora or New Zealand and other communities who are doing good work. So we have a particular challenge in the Northern Great Plains where we suffer from some of the greatest health disparities for a complexity and a myriad of reasons. And so I'm really honored to be doing the work here in Grand Forks, North Dakota. So PBRNs, like me, started around the 70s, and they aim to decrease the amount of time that we take science and put it into practice. So it takes sometimes 17 to 25 years to take scientific research and apply it in the clinic where doctors apply it to patients. And what we can really do with PBRNs is take the knowledge that already exists and implement that with implementation science. And that's, I think, what Alaska Native and American Indian peoples are so good at, is applying knowledge. And so this kind of research network is kind of ideal for us in that it can help us to network across regions or across populations, or maybe even empower our own population to implement those changes in an effective way. So before we started our network, there just wasn't representation here in the Northern Great Plains. And now in the Dakotas, Wyoming, and Montana, we have this mechanism called the PBRN, where we can organize, share information, and especially share resources, but also be mindful of our own unique needs and our own sovereignty. So we're a network of healthcare clinicians and practices. We include tribal and urban and IHS settings as best we can. And we're really working together at the grassroots to address community-based healthcare questions. So I'll give you a summary of those in a couple of slides. And we aim to directly engage our participants in helping to prioritize what they want to research. Namely, it's behavioral and mental health services are what folks really want us to prioritize. And this is just an example of sometimes when we do research, we start with a question and then have a big study and analyze that data. But really, we can just start a different place on the circle and implement that, the studies, and implement what we need. Just like you're seeing with the MMIP project, that we're able to make those changes by specifically addressing the needs by bringing in those legal and other partners so we can make change now. This is a reminder that there's a movement nationally to build and improve research infrastructure that's inclusive of us as Indigenous peoples and specifically to engage us. So there are resources online like you see here, and also that these programs are aimed to help address structural racism. And I think these are tremendous movements forward compared to where we were 20 years ago. So just another resource there for you. We also aim to empower underserved positions and lenses, including New Americans, LGBTQ2+ populations, and involving youth, women, and rural populations. And when we think about the imagery of the acorn, it's from a single seed, we can have an entire ecosystem, not just a forest, but an entire ecosystem. So just being aware of that imagery is so important. Also, I'm reminded that in harvesting and processing acorns, there's traditional knowledges that's transgenerational that allows us to use that as a plant medicine and as a food. So we have to leach the tannins out by using lye. And what I mean by that is that we actually use charcoal and our ancient modern technology of boiling water with charcoal included in it would help to leach the toxins out of the acorns to make them more edible. So that's just a real tangible example of how the acorn represents traditional knowledges. The way that our research network at the University of North Dakota works is that we have partnership agreements. And right now we have 6 agreements with Monument Health, our Community Healthcare Association of the Dakotas, and our tribally owned and operated health system, that the Oyate Health that you see there is related to 18 different tribes in our region. Essentia Health and our 2 family medicine centers that train residencies or that train family medicine residents are also included. I just want to highlight here on the left side that we have internal stakeholders that we partner with, and I'm a part of the Department of Indigenous Health, where we have our first Indigenous Health Department affiliated with the School of Medicine and Health Sciences that offers a PhD in Indigenous Health. So that's a really cutting edge opportunity that we should be aware of. And here I want to emphasize on the right that our community members can really benefit from research, just as a reminder, in that they can participate, but also we can have more power in our research if we join together and hopefully implement things that are meaningful for our health right now as a community. So right now, we're working to empower the idea of an Indigenous School of Health Sciences, where we train ourselves in our way in a school of medicine. It's sorely needed, and there's some initiatives that we've started in that regard. So if you're interested to collaborate around an American Indian or Alaska Native School of Medicine and Health Sciences, please let me know. Also, I've been working with the American Heart Association as well as the United Nations on creating Indigenous determinants of health manuscripts. Another example of the work that we're doing is there's a study called the Katori study that we've implemented through collaborators that looks at subspecialty referral patterns for Alaska Native and American Indian individuals who've been referred to neurology, ophthalmology, and oncology services. And you can look at that website if you're more interested in that. There are a few other projects that we have going on, including co-locating food distribution with primary care. And in the interest of time, I'd just like to give my wonderful panelists a little bit more time to share. So I'll close there. I want to say Anamasi. You can access our websites for more, or feel free to email me. I'm so grateful for your time. Thank you.
Thank you.
Thank you very much, Allison. So next, Stephanie, you want to start queuing up your slides?
Also unmute, that will help a lot. So thank you, Agnes and Allison. I'm really grateful to be speaking after you. And so Sidak Atnakastan, Sidak Stephanie Carroll, Tishista, Slandak Nalchina. So I'm Stephanie Carroll. I'm Dene Atna Athabaskan from the native village of Kludika and of Sicilian descent. And I have been down here on Otham and Yaqui lands in Tucson, Arizona for over 20 years. And so, oops, sorry, everybody. I am really honored to be talking to you today a little bit about the Collaboratory for Indigenous Data Governance, and you're missing my first slide, which talks about research as love and connection, and really thinking through how the work we do comes from our heart, but also from our responsibilities and our commitments. And so I'm going to talk you through a couple projects, just very briefly, but mostly orient you to the focus of the work that we do at the Collaboratory. So without further ado, I'll give you a little bit of background about me, and begin by saying, we can see here, I am this tiny little baby in the top left, and that's with my mother and her Sicilian family who had come here to the East Coast of the US, and then juxtaposed with my father, the cutie in the middle, and up in around, that's actually around Chitina, Alaska. And just a real loud shout out to the network of Indigenous scholars that I work with, and how, even though we come from a variety of different communities, different disciplines, our great work really comes from being together on the land. And so you see us here being silly in a photograph. I believe that is in Botswana, actually, although it looks very similar to being in Tucson. And so my background really as a scholar was one who was not really certain exactly what I wanted to do, other than follow in the footsteps of my mother and work in public health. And so I started out as a math major, actually, and shifted into biology and society as a major at Cornell University, which was part of their science and technology studies department. And I just always like to add that in there, because then my further journey moved me to Arizona, and I've been here ever since, working in the College of Public Health in a variety of ways. But my commitment has been to really thinking about how public health connects with Indigenous communities, and also the environment and data. I'm really always going back to those numbers, but also thinking about how those numbers are our stories that we utilize for keeping our communities healthy and thriving. And so through the University of Arizona, I've been working at the Native Nations Institute for over 20 years. That's where I worked as a grad student, and have had, as I like to say, almost every position you could have in that role. So administrative background, as well as teaching and research background. And so once I received my doctoral degree, I worked with a number of other scholars to create the Collaboratory for Indigenous Data Governance. And so we work to build upon and support the movement to develop new institutional frameworks that center the terms of Indigenous communities around research and data partnerships. So our team members engage tribal rights holders and institutional partners through research, education, and advocacy to understand the barriers that they face and to identify critical opportunities for change. So our goal really is to move beyond mere recognition of Indigenous rights towards data, towards institutional policy and practice changes that protect and strengthen Indigenous people's relationships with their data. And I'll talk a little bit more about why that's so important in a moment. But we do this through engaging diverse disciplines. So I'll show you a picture of folks in a moment, building community, practicing our own personal, but also group accountability to those we're accountable to, generating collective knowledge, and all of us to transform, like I said, institutional governance and ethics for Indigenous control of Indigenous data. And so we work in a couple pockets of areas. We analyze institutional research and data laws and policies at tribes, federal environmental science entities, for instance, and universities. We do that largely at the request of other institutions. So tribes are interested in what tribal research codes look like and how to strengthen them. Also, we are a model to a lot of other Indigenous peoples across the globe who don't have tribal research review boards or tribal research codes and want to know what tribes in the US are doing to support their self-determination around research and data. We also work internationally to operationalize the CARE principles for Indigenous data governance. Those were put out by some of our team members, as well as a global network in 2019. And we've seen them embedded and into international and some nation state and policies over that time period. And then finally, we partner with tribes and other communities to increase governance capacity, capability, and infrastructure. And so here are some of the myriad of people who have worked in the collaboratory. So we are primarily Indigenous scholars. We are global, so we have Indigenous scholars from Africa, from New Zealand, and we access funding from foundations, so the Udall Foundation, the Luce Foundation, from the big Fed entities such as the National Science Foundation and NIH, as well as others. And critically, we cross college and university boundaries. So we include Indigenous University of Arizona team members from across our own institution. But we also have an alumni network that we work with on research. So you see folks like Cheryl Ellenwood here, Desi Small Rodriguez, soon to be Lydia Jennings, who will be moving to Duke in a postdoc, who we work with as they move across and start their own projects up. And then we work internationally with Indigenous communities and partners from across Asia, the Pacific, and increasingly so South America, Latin America. And I'm just going to go off on a tangent here and speak back to that love and connection aspect. So as a team, from a team perspective, we recognize the importance of addressing Indigenous community questions through transdisciplinary research that really accesses and uses diverse ways of knowing. So this means that prioritizing Indigenous knowledge systems, but also utilizing various disciplines and a myriad of individual experiences. And so we support and train emerging scholars and ourselves to consider and include policy and service to community as core components of good research. And I was talking the other day and saying how, you know, a lot of times I'm accused of being an advocate or an activist, not a researcher, because I talk about self-determination and sovereignty a lot. And this is something that a lot of the students who come into our programming speak to as well, that they want to do a dissertation in this science or in this this discipline, but they're told that the policy isn't really part of it, or sovereignty. Actually, I was told sovereignty, it wasn't a core component, and just turned around and basically had sovereignty as the core component of my dissertation work. And so we support and forefront the understanding that science and research is inherently political, especially for us as Indigenous peoples. And as Indigenous researchers, we are not walking too fast. This is our walk. We are bringing our whole selves to our practice. And so while we've been called activists and advocates, I stand strong if that's really what I'm going to be called, because the role of self-determination and sovereignty in our research practice is critical. And so I begin here by saying that the core part of the work that we do around Indigenous data is predicated on the fact that sovereignty matters, that the settler colonial project has not ended, that this colonization causes inequities that are fundamental to making change for our communities. And that nevertheless, Indigenous peoples survive, thrive, and persist. We are strong. And one of the core components of that is that data are our relations and are part of our healing journey. So this is, often data have been used to further assess the progress of the colonial project to kill and erase us as Indigenous people. We need data that addresses our interests. And these indigenized data for decision-making shift the narrative from deficits and deficiencies to our well-being, resurgence, and persistence. So at the same time, tribes are enacting relational responsibilities to their data, so governing their data in ways that align with their values and interests. And so we also know, and this is where I'll end on this slide, is that self-determination and governance lead to healthy, vibrant communities. And so how can we as researchers, those of us who work with repositories, funders, and other institutions support this shift to self-determined, community-engaged science? One important way is through changing data relationships to support Indigenous data sovereignty through implementing tools for Indigenous data governance. And so really, we're thinking about how do we move institutions from extractive transactional data practices to reconfigure power to put Indigenous data in Indigenous hands. So some of the work we've done is with international colleagues to do an analysis of how do you build trust, enhance accountability, and improve equity. And this was focused on genomics research, but it is broadly applied. So we think about how do we formalize data access and secondary use agreements? How do we protect personal and community identifiers? How do we recognize community rights and interests? And how do we embed that into our practices? One of the other things that we've done is shown how in a published by Dr. Nanaba Garrison here on the right, how the US federal policy seen here in the right for research oversight, so the human subjects policy that we live under here in the US, doesn't address critical considerations for Indigenous communities. So there's no requirements to engage communities for community use, for community approval for secondary use of data or specimens, for community approval of research findings, and so forth. So while this is disappointing, we know that the Common Rule, which was recently updated, will unlikely change anytime soon, which really demands action in other sectors. And so I talked about the CARE principles and for Indigenous data governance, and we've seen through in other nation states, critically other English settler colonial nation states, that it's been embedded in federal policy. Dominique David Chavez, one of our collaboratory team members, in her federal testimony recently showed that the United States has not embedded the CARE principles at all. And so how do we move towards ethical Indigenous data governance? By bolstering across all of these institutions. And really the grounding of that is in Indigenous communities. And so when I talk about the CARE principles, people often think, well, how do we force those on communities? But we're not forcing them on communities. What the CARE principles do is they point down and say, if you're doing data work and research with communities, you need to ground that work in community ethics, in your responsibilities to those communities, in that community's self-determination and how they want to act and what they think of as collective benefits in those communities. And then one of the other research projects led by Dr. Ibrahim Garba, also here at the University of Arizona, has been looking at tribal research codes, and I spoke about this earlier, but we think about them not only as how do we strengthen tribal research codes and other tribal codes that address research and the environment and data and so forth, but how do we set those forth as the expectations that tribes have put out there to enact, for instance, the CARE principles or our responsibilities as Indigenous researchers, because we know tribes have a lot of things to do and they can't answer everybody's questions, but they already have these expectations set out there. So how do we make sure that we're accessing those already set out expectations? So thank you, Agnes.
Thank you very much, Stephanie. Very comprehensive overview, which this is like a whole semester's course in just 10 minutes. So our last presenter, Melissa, would you want to cue up your slides?
Perfect, thank you. All right. Well, thank you so much, Stephanie and Allison. What an honor to speak with you both. You're extraordinary. I'm big fans. So thank you for laying down such important knowledge and teachings. Buju Nindinwe Maganitug, Melissa Nelson Indigene Kaz, Makunzi Gabawiki Dashnindigo, Nin Anishnabe Ikwe, Piju Dodem, Mikanakwa Jiwing, Turtle Mountain Chippewa, Nindunji Ba. Amiu Miigwech. I said, hello, relatives. Good to see you today. My name is Melissa Nelson. My Ojibwe name is Makunzi Gabawik. I am a proud member of the Turtle Mountain Chippewa Nation, member of the Lynx clan, and it's really good to be with you. Thank you for being here. I wish we were there in person, but I'm glad we're all together, even online. A little bit more about my background. Mixed heritage woman. I am native from my mother, Anishinaabe, Cree, and Métis. I am Norwegian settler from my father, product of the upper Midwest, North Dakota. Hey, North Dakota. I was born and raised in Northern California due to relocation. My mom got her one-way bus ticket from the res in North Dakota to Oakland, California in 1954. So I was part of the urban Indian community in the San Francisco, Oakland Bay Area. Received my PhD in ecology at UC Davis with a strong focus on Native American studies and indigenous ecology. And I do identify as a scholar activist. I am unapologetic about that. Justice and rights and self-determination and sovereignty for me always take precedent. I am a new professor hired in 2020 at ASU, really forging the field of Indigenous sustainability in the School of Sustainability. And for almost 30 years, I worked with an Indigenous-led organization, the Cultural Conservancy, still serve on their board of directors. And so a lot of my community-based initiatives are in partnership with that NGO. For me, to really center Indigenous ways of knowing, doing, and being in research and learning is a process of reclaiming our cultural frameworks, whether they are Dene frameworks or Ojibwe frameworks or Akimel O'odham frameworks. It's so important to go back to our original instructions, those values, those ethics, which are rooted in our Indigenous languages. I was just here at UNESCO for the launch of the Decade of Indigenous Languages. It's such an important place to remember who we are and to keep activating those traditional voices. That requires us also to go through a process of decolonization from some of the Eurocentric paradigms that have been so harmful to our communities, including the methods of research, and to really recenter our ways of doing research and to weave different ways of knowing together. And it also means that we must do cultural affirmation to remember who we are, to be proud of our cultural identities, to center our knowledge systems, again, those worldviews, those traditional practices on the land, and to enact our self-determination and sovereignty. And I've been very honored to work with many Indigenous knowledge holders. Many of them identify both as artists and scientists, something that we still divide in the universities. And so I think a way to really center Indigenous ways of knowing is working with traditional knowledge holders who often show up as artists, basket weavers, dancers, wood carvers, etc. But embedded within their artistic traditions are actually scientific knowledge systems about plants and animals and pigments and dyes. So it's been wonderful to do the science of place through traditional knowledge holders. Sorry, there we go. And really, the previous speakers presented this so well, but we must embed all of our research in traditional protocols and practices through a co-design process. One of the First Nations leaders here said, co-design means going to the table with a blank piece of paper. I thought that was a great traditional teaching. You don't go even with all this other background data, but you go with a blank piece of paper to listen to community for their priorities and their research interests, whether that's from their tribal governments, of course, their elders, their leaders, and from their youth. And it takes that time to build those good relationships. I firmly root my research in free, prior, and informed consent, the EFIC principles as outlined in the United Nations Declaration on the Rights of Indigenous Peoples. I think that's a very important instrument and tool to continue to implement at various tribal, state, and national levels. We know the great work of Linda Tuhiwai-Smith with decolonizing methodologies, Indigenous story work with Joanne Archibald, Research is Ceremony by Cree author Sean Wilson, and I believe in community-centric and intergenerational approach to research that again is rooted in environmental justice and Indigenous rights. So coming from an ecological background, but also an Indigenous studies background, a lot of my work focuses on indigenizing science, and that involves land protection, the land back movement, land rematriation, ecosystem conservation, as well as building and restoring sustainable community development and cultural revitalization, including language revitalization. For 18 years, I taught at San Francisco State University and led embodied Indigenous research and learning practices with California Native communities around many different areas. And this really instilled in me the power of this transformative learning on land, place-based learning with tribal elders. And for me as an Anishinaabe woman, I'm working on many different ways of knowing, being, and doing my own research. And I want to just mention a couple of key concepts from our language. Biska biang, to return or look back, to make a full circle. And that is one of our traditional concepts for how we do research. Also, Nanda Kikindan, to seek to know, to seek to learn, but also to navigate change. And these are some traditional concepts and ways that we talk about our forms of research. I'm starting a very exciting project, Miniska Resurgence, Little Islands, with a group of international scholars based at a University of Victoria, Archipelago of Indigenous-led Resurgence for Planetary Health. And we're doing that's a long project, but it's very exciting. If anyone wants to know more about it, I'm happy to share. And another exciting research project I want to let you know about is weaving relations, interdisciplinary, actually transdisciplinarity, identity-based, immersive team science experiences. And through my wonderful colleagues at ASU in the ESSA program, Earth Systems Science for the Anthropocene, we received an NSF Racial Equity and STEM grant to train and work with Indigenous graduate students, as well as Latinx graduate students on team science experiences. These will be summer research experiences in various locations on the land, in the field, and will focus on co-produced Indigenous research questions, methodologies, and production of knowledge, all the way through sharing and data sovereignty. And we will be doing this with the organization I mentioned, my summer program coming up. They will be partnered with different groups, Navajo Nation planned, other urban Indian communities, and we will be working with the Cultural Conservancy next summer based on food justice and well-being. So we'll be focusing on restoring agrobiodiversity with Indigenous agricultural methods, but also how to share Indigenous foods with urban Indian communities and the kinds of programs that are being developed on the ground for health and well-being, diabetes prevention, and many different creative projects. Again, this is all about supporting our Indigenous food systems and well-being with small gardens, rooftop gardens, permaculture design, tribal enterprises, economies of solidarity and food distribution. So it's very exciting work that we're building on, and the students will be doing original research on and with. Another program I want to let you know about in my just short time at ASU, I've been very, very fortunate to develop an Indigenous Knowledge's focal area of our Global Futures Laboratory. It was co-produced and founded with Dawn Fixico, Brian Brayboy, Stephanie Fitzgerald. Many student leaders were a part of it. We received a seed grant and started a series of Indigenous dialogues about Native science, Native ways of knowing and doing research. We produced a short film that we are going to share with you at lunchtime. I hope you can all watch it. We hosted 3 Indigenous chefs for Earth Day. It fed over 100 people at ASU. We've applied for some grants, some received, some not. And we collaborate with other focal areas in the Global Futures Laboratory. One of them is a collaboration with the Narrative Storytelling Initiative, Stephen Beschloss of GFL, and we are highlighting sounds of the land. So an acoustical ecology project, sounds of places, but also personal stories of belonging. The long-term goal is how can we increase empathy and understanding interculturally through hearing stories of belonging in different locations, different cultures, and different places. And I'm so happy to present to you today at lunchtime. Please take time to watch these 3 brilliant Indigenous graduate students, Taina Diaz-Reyes, she is Taino, Maya, Huicholi, Alicia de Mesa, Apache, and Joseph Gazing Wolf, Lakota. And we produced a short film discussing indigenizing science. And when I came to ASU, I knew the first thing I needed to do was just listen to the students, listen to my fellow faculty, listen to the local communities, and get to know what people's interests were, research backgrounds were, academic backgrounds, but also personal goals and professional goals. So we will be able to show this film to you in just a few minutes. It's very powerful. It was produced myself and directed by a wonderful ASU art graduate student, Bradley Smith. And just really going off of the information already shared in the last presentation, this is a global movement. There are Indigenous researchers, in Maasai lands and on the highlands of the Andes and on the islands of the Ainu in Japan. And there was a global movement to reclaim our rightful role as producers of knowledge. And it's so exciting to be a part of this movement with all of you. Thank you so much for listening and for all of your amazing work. Miyu Miigwech.
So thank you very much for our 3 panelists, scholar activists who talked about Indigenous knowing, being, and doing wonderful presentations. And so we'll transition over to lunch will be coming up. Jacob?